This is another Puscast covering the last 15 days of January 2016. The references, as always, are available online, and you can find that and links to my growing multimedia empire over at edgydoc.com. Otherwise, you've probably heard this stuff before, so let's move right on to the literature, shall we? We'll start, I suppose, this time with some antibiotic side effects. The first is clarithromycin, and in an article in the BMJ that was published recently, suggested that patients who got clarithromycin had an increased risk of a cardiac death. This is also in line with other antibiotics with this risk, azithromycin and the quinolones. It's not a huge risk, 1.9 excess deaths per 1,000 patients, but if you happen to be that patient, it's not so excess, is it? It was bigger risk the older you were and the more comorbidities you had, such as diabetes and hypertension. So don't give macrolides, the newer macrolides, if you don't have to old diabetic cardiac patients. The big side effects of daptomycin, as listeners know, is elevated CK and rarely eosinophilic pneumonia, of which I've seen two. There's also, lucky us, liver injury. Most of the cases of daptomycin-induced liver injury have evidently been reported with elevated CKs, but it can occur independently of CK elevation. So you can add hepatitis to your list of side effects to watch for daptomycin. And finally, minocycline. So what's happened? Well, we have all this MRSA, right? And so we started using doxycycline, which has gone up in price like 2,000% in some places. So instead, people are going to be using minocycline, which is probably as effective and is still relatively inexpensive. But what's the side effect? Well, it causes cutaneous hyperpigmentation. This has been described in people on the drug for acne. It's now described as well in patients who are using it for orthopedic reasons. Not as bad as turning blue, i.e. turning into a smurf if you're taking colloidal silver, but still nobody wants to get hyperpigmentation, including orthopedic patients, but at least they didn't have any acne. Zika or Zika? I don't know. They never have pronunciation guides with these new infections. It's in the news lately, and Zika virus causes an febrile illness with a rash. Most people, it's benign. It's yet another flavivirus. And it can be mistaken for dengue and chikungunya. All three of those, as well as yellow fever, are right up at our borders. So the big question really is going to be, how bad is Zika infection going to be in the United States? And the CDC does not expect it to be that dramatic in the U.S. I don't know. I'm still expecting one of those, dengue, chikungunya, or Zika, to hit the U.S. sometime in the near future. You can't stop mosquito-borne illnesses. The big question is, who is it going to affect? And I would bet it's going to disproportionately affect poor people, because poor people don't live in air-conditioned houses, so they're going to be more likely to acquire these mosquito-borne illnesses. The vaccine is probably several years away at best. According to the CDC, they do not expect trials to begin until next year. So it's going to be a while before we start seeing vaccine trials. I'm going to get it the day it comes out. And the big problem, of course, is microcephaly, which has been associated with the Zika virus, which is awful. Hopefully we'll have a vaccine so we can prevent this horrible side effect, because we have enough Republican presidential candidates as is. We don't need a virus making more. Should you suspect a case of Zika virus, the CDC has wonderful information on how to evaluate a pregnant woman, what tests you need to run, etc., etc. I won't put that into my brain until I need to. Just remember that these infections are always a mosquito away. For example, in the fall of this year, there were 107 cases of dengue in Hawaii on the Big Island. 93 of them occurred in Hawaiian residents, 14 in travelers. Dengue is not endemic in the state, but every once in a while, The virus sneaks in. All you need is an infected person who comes over and gets bit by a mosquito, or alternatively, an infected mosquito hitches a ride on a jet plane. Just remember that in 1999, there was no West Nile in the United States. Then with birds and mosquito, over the next 4 or 5 years, it basically crossed the United States a little bit slower than a Conestoga wagon. It always goes back and forth about the efficacy of the flu vaccine. I tend to think that the data shows it's of modest efficacy on individuals, but you probably get better effects when you vaccinate populations. However, it's hard to sell population benefits to people. However, in New York City, they looked at the efficacy of the vaccine in low-income urban households using PCR and found that the flu vaccine in 2013 to 14 was 62% effective. Not bad. Multiply that by large populations and you'll probably get benefit of the flu vaccine. It also, in a recent study, was found to be beneficial in patients on peritoneal dialysis. And they found that getting the flu vaccine showed a decrease in morbidity and a 34% reduction in mortality. This was in a population of about 2,000 peritoneal dialysis patients. And there are those who would argue that those who get the vaccine are probably getting overall better medical care, and that's why they do better. I don't know. But I still think the benefit of the flu vaccine is real, albeit modest, in large numbers of different patient populations evaluated. Everybody has their dream clinical trial. The anti-vaccine wackaloons want to do a vaccinated versus unvaccinated trial to see if there are differences in autism. I would like to do a study where the eastern half of the United States does not get the flu vaccine and everybody in the western half of the United States, the Mississippi on over, does get the flu vaccine, and see what happens to those two populations. Of course, I live in the West, so I don't want to be in the placebo group. But I think if you could do that, which is, of course, totally impractical, then you would truly find out what the benefit of the flu vaccine was on populations. And as pointed out in a prior article, I believe in Science, it's not just the flu vaccine, but it's your lifetime exposure to both vaccines and wild flu that determines your immunity. This study looked at serum samples of adults who had received multiple seasonal influenza vaccinations and looked to see if they had cross-neutralizing antibodies to other pandemic strains of flu. And some did and some didn't, depending on the strain of flu. So it depends on what your antibody is directed to against what particular antigen on a given hemagglutinin. And sometimes you'll get really good benefits from the flu vaccine and sometimes not so much. But it could be protective against other strains of flu if you are lucky. Flu vaccination is, unfortunately or fortunately, a complicated and nuanced area. Not like tetanus vaccine, which is pretty straightforward, comparatively speaking. The vaccinia virus is most famous as the virus used in the smallpox vaccine. And curiously, since 1999, there's been an ongoing outbreak in Brazil of vaccinia virus, of all things. And the question is, where did this pox virus come from and where does it hang out? It certainly is present in cows and is closely related to cowpox. But also they found, at least in Brazil, that it could be found in dogs and possums, and that they may be a reservoir for the infection as well. It certainly would not be the first time that wild animals then passed infections to domesticated animals, which then passed the infections on to human beings. I didn't even know they had possums in Brazil. I thought that was a North American problem. They're creepy-looking animals, just like the rodents of unusual size. PCR, where would we be without you? This study did PCRs of the spinal fluid of the elderly, greater than 65, which I'm a mere 7 years away from. I'm getting old. Anyway, they looked at old folks coming in with an encephalitis or viral meningitis and did PCR. They did 2,868 PCRs on 502 CSFs and found an occasional positive. Just so you know what to look for, 23 patients had HSV, herpes simplex. 15 had enterovirus, 14 had EBV, 12 had VZV, and 1 had CMV. Not unsurprisingly, most of the time you have no idea what's going on with these alleged viral meningitis/encephalitides. But herpes simplex and VZV were certainly the ones you could treat in that list and are worth looking at. I would be suspicious whether the EBV was a true diagnosis or just a fellow traveler. But it gives you an idea what to look for the next time you have an encephalopathic old person hitting your door. If it should be me that's being admitted, just remember that my CSF VDRL is a false positive. I keep telling my primary that anyway. Pigs and hepatitis E, it's certainly in Europe, go together like peanut butter and jelly, or in this case, like a spit-roasted piglet. So they had a outbreak of hepatitis E in France that they traced to a spit-roasted piglet. That was probably delicious. They found 17 cases of people who had hepatitis E from eating this spit-roasted piglet. But the interesting thing is, 71% were asymptomatic. And which part of the piglet did they associate the infection with? Undercooked pig liver-based stuffing. I am quite the fan of France. I'm a big Francophile, and I love French cooking. But they do have a nasty habit of undercooking some things that are best cooked well. I remember at a bistro in Paris, I ordered the pigeon out of curiosity, and it was rare. Ugh. Birds need to be well cooked, and so does your pig liver. I just wished when they did articles like this, they'd also include the ingredients so you knew exactly how this piglet was spit roasted and exactly how they made the stuffing, just for, entertainment's sake. Dear Ticks. That sounds kind of like a letter, like Dear Abby. You've probably been well aware of the Borrelia miyamotoi, if I pronounce that correctly, is a relatively newly discovered Borrelia throughout the United States. From whence doth it come? Well, this looked at the presence of this in ticks in deer in Wisconsin, don't you know? And oh yeah, sure, they found the prevalence of deer-associated ticks, was... So one of the reservoirs may be white-tailed deers that are infested with adult black-legged ticks. And what about those bloodsuckers in Texas? I'm talking about ticks here. They took ticks and screened them for Rickettsia, Borrelia, and Ehrlichia, and found there were 13 different ticks from humans, and 23% of these ticks carried at least one of the above by DNA analysis. Although not all of them were, for example, human pathogens. They found reptile-associated Borrelia, technically not a human pathogen in Texas, as well as relapsing fever and Lyme Borrelia. And different ticks tended to have different organisms. For example, Borrelia lone storii was found a lot in the amblyomma tick, where Ixodes scapularis was associated highly with Rickettsia buchneri. So the take-home message is to be leery of bloodsuckers when you're in Texas, be it mosquitoes, ticks, or fill in the blank. This is an epidemiologic study, but take it with a grain of salt substitute. Evidently, there was a study that showed that there was a strong association between bitten by a cat and getting depression. And they thought maybe it was due to toxoplasmosis that did it. So this went back and looked at patients who had been bitten by a dog, bitten by a cat, or scratched by a cat. And it turned out that if you were scratched by a cat, you were much more likely to have depression than if you were done bit by a cat. So they postulate that it's not the toxoplasmosis, which makes you a crappy driver, but perhaps Bartonella Hensley, the cause of cat scratch disease, that may tip people over into depression. We don't quite yet have Koch's postulates, but it does bring home the importance of the autoclave as a way of keeping one's cat pathogen-free. This was a study about Bartholin cysts in their presentation. Interestingly, the cultures grew predominantly E. coli, which were found in 22% of patients, and streptococcal species, 10% of patients. For some reason, I had it in my mind that Bartholin cysts were usually Staph aureus, but these tend to be polymicrobial and tend to be organisms other than Staph aureus. Of course, the treatment of any abscess, if you can, is to drain it, but it does make a difference, perhaps, in your initial antibiotics if you're worried about E. coli and strep. I was shocked at this study. They looked at the incidence of penicillin-susceptible Staph aureus in the United States in 2013, and they found a whopping 13.5% of 3,083 Staph aureus, were susceptible to penicillin G. I would have thought it would be 1%. I never see one of those. If you do, by the way, see a penicillin-susceptible Staph aureus, use penicillin to kill it. It is like shooting ducks in a barrel, which I have never done, so I actually don't know how easy it is to shoot ducks in a barrel, or fish in a barrel for that matter. Also, while we're on the topic of staph, they looked at MRSA in Australian veterinarians and found that frequently the humans and the horse, the humans and the pig, and the humans and the companion animals shared the same Staph aureus. You have different antibiotic prescribing patterns in horses versus pigs versus other animals. And there were different strains depending on whether or not it was a horse or a pig. And so maybe antibiotics, they hypothesize, select for different staph depending on the species. I would bet it's probably more binding sites in the different animals that select for the species, but that would be my hypothesis. And finally, when it comes to Staph aureus, this looked at adjunctive corticosteroid therapy in patients who had staph bacteremia but were hemodynamically stable. And they found that patients who had steroids started early in their course for Staph aureus bacteremia had increased mortality compared to those who didn't. So if you have someone coming in with staph sepsis and you think they should be on steroids for some other reason, try to hold off for a week or two if you can. It was the early use of steroids that was associated with increased mortality. We talked about the New England Journal of Medicine article from a couple months ago that demonstrated very clearly that as long as you had source control, 4 to 5 days of antibiotics was all you needed for intra-abdominal sepsis or intra-abdominal infection. In the subset of sepsis, in this study that went back and looked at the data, same thing holds. It really doesn't matter if the patient's bacteremic or septic. It's all about source control. If you take out all the pus and drain it, patients only need a short course of antibiotics. Any bacteria in the bloodstream is rapidly eradicated, probably with 1 dose of antibiotics. And then the question is, what's the chance of a metastatic complication? And that's predominantly Staph aureus and to a lesser extent Candida albicans. But for the vast majority of bugs that end up in the bloodstream, streps, E. coli, pseudomonads, they don't go places to cause problems. And once you eradicate the source, you don't have to worry about the bloodstream or metastatic complications. And for the vast majority of infections, 3 to 5 days is sufficient, even if they're bacteremic, as long as you got your source control. We usually give 10 days or 14 days because we got 10 fingers and we have 14-day weeks. Perhaps what we need to do is just amputate everybody's hands and we can have all the antibiotic prescriptions in the United States. People will probably start counting their toes, though. So, what's your risk of getting the Hershey squirts on a cruise ship? Well, the CDC has let us know. Between 2008 and 2014, 73.5 million people went on cruise ships. Of these, 172,810 came down with some sort of acute gastroenteritis. That was 0.18% of passengers and 0.15% of crew members. 92% of these, when tested, were norovirus. So it actually is fairly uncommon, given the volume of travel, for people to get an outbreak of gastroenteritis. They estimate that of the 29,107 voyages, 133, or 0.5%, came down with an outbreak. So you're pretty safe to go on those Disney cruises, which I think is nice to know because my wife and I are heading for our 30th anniversary, and we're thinking of doing a river cruise in Europe as one of the ways to celebrate. But who knows? We're a long way from that. Year and a half to go. I am not, however, going to go on a river cruise in Kenya, which is having a cholera outbreak. I tend to think of human beings like Pigpen, Charlie Brown's character that was always in a cloud of dirt. It was so depressing on rounds last week. I mentioned that, and 2 med students had no clue who Pigpen was. But I figure that we're just shedding bacteria in skin all the time. In this study, humans differ in their personal microbial cloud, demonstrates that. They stuck semi-naked people in a room and sucked off all their microbiome that they were shedding into the environment and found that each person had their own individual microbiome that they shed. Not a surprise. If you actually think about what's in and on us, you'd never touch your significant other. I mean, ew. A disease I never heard of, which is not surprising. There's lots of diseases I've never heard of, but it's called Far East Scarlet-like fever. Does scarlet-like fever? Scarlet-like Tara. Anyway, I digress. It turns out that Yersinia pseudotuberculosis in Russia and Japan causes a scarlet fever-like syndrome, and it's due to a superantigen, toxic Y pseudotuberculosis-derived mitogen A, which causes, again, the scarlet fever-like illness that's seen with Yersinia pseudotuberculosis. While there are outbreaks in the Far East, there have also been reported sporadic cases in the United States. The illness is a little different than the classic scarlet fever. It does go through several stages that make it a little different from the classic streptococcal disease. Incubation, which is not really it, vague symptoms, then they get the hyperemia and coryza. But interestingly, because it's an abdominal illness, they then go on to get generalized symptoms, including abdominal pain. And as you know, pseudotuberculosis often presents with abdominal pain, as well as diarrhea and mesenteric adenitis. And then they go on to get better. The take-home pearl is if you see a case of scarlet fever, but they have a lot of gastrointestinal complaints, think of Yersinia pseudotuberculosis. Of course, I live in Oregon where we don't see a lot of coal mining. But if you happen to be in a coal mining area, in Illinois, there was a case of tenosynovitis due to Mycobacterium marinum that was due to coal water exposure. And if you happen to live in South Africa, there was an outbreak of lymphocutaneous sporotrichosis in mine workers. The marinum they traced to the water. The sporotrichosis was traced to contaminated soil and the wood that was being used to reinforce the mine. Those guys are so possessive, too. It's mine, mine, mine. Stomach acid, good. This study out of Taiwan shows that if you get the development of GERD and get put on a PPI, you have a significantly increased risk of TB. Just one of those many risk factors, remembering that no good deed ever goes unpunished. And have you ever heard of the Lübeck disaster? I haven't. Way back in 1929, 251 neonates were given 3 doses of the BCG vaccine, but it was contaminated with MTB. And a third of the kids died of TB. How awful. No great insights, as it were. It's just one of those curiosities about early treatment of tuberculosis or to prevent tuberculosis, the details of which you can find on PLOS One. But that is just awful and kind of interesting in an awful way. I suppose that's it today. I'm on call this weekend. I'm a little tired, and there weren't that many articles I found at the end of the month. There are months when you have lots and months when you have little. The references are available online, should you be so interested, over at edgydoc.com. Puss Whisperer 2 is out. It's not yet available on Amazon, but if you search for Puss Whisperer 2 or go to the Biting Duck website, you can purchase one or more copies because both volumes make wonderful gifts for Christmas, birthdays, whatever. Marriage gifts. Someone gets married, what do you give them for a present? Who needs china? I always give them power drills. That was my dad's idea. Anyway, that ends this podcast. Thank you, as always, for this most interesting consultation and allowing me to participate in the care of this most difficult and challenging case. I shall continue to follow along with you. Thank you, in dictation, and goodbye.